Hi, I'm Helena Karakazi, and I specialize in neuroplasticity and natural brain repair. I work with both children and adults who present with a variety of neurological symptoms, such as epilepsy, Lyme disease, autism, ADHD, processing disorders, headaches, sleep issues, chronic pain, movement disorders, depression, anxiety, panic attacks. And I do brain imaging, and based on the testing, I put together a customized, individualized plan of how to best rehabilitate the brain. And that can involve some biofeedback, some nutrition, other therapies, all based on what the person needs. I teach in medical schools. I have a private practice, and I also am now able to work with people over the internet. So let's take a look at how all this works. Welcome, hi! Come on in. When I teach on the brain, I try to think of a way to explain how the brain breaks down. So the word that I came up with was spectrum. So autism spectrum, that's me. How are you feeling today?
I'm good.
Good. Are you ready for your biofeedback session?
Yes.
Yes. And how did you sleep last night?
Good.
It all started to fall apart just before he turned 2 years old. His speech just stopped. It completely halted. And it was terrifying. It was really frightening. Now you hear all these things happening to the children, things just going wrong with how they're growing up, and with the autism rate and whatnot. I think it's a fear of every mother, really. And you do the best you can, and you think everything, you're on the right track, and then something like this happens.
Okay, Artie, I'm going to put it on your ear. Okay, just like that. Is that okay?
Yes.
Yes, and I'm going to put on the other side now. Okay, and now I have to pick a location. This is very important based on the brain map of where to put the sensor. So for Artie, we're going to start here. How does that feel?
Yes.
Good, okay. Are you sleeping better now?
Mm-hmm.
Yeah, and how about your stomach? Does your stomach feel better?
Mm-hmm.
Yeah, and you could use your words better now?
Mm-hmm.
Yeah, and okay, let's start the session. So I'm going to start, and here's Artie's brainwave pattern. And what we're going to do is, when the sounds come on, it means that his brainwave pattern, which is right here, all in color, there are certain thresholds or settings that I adjust, and there's a range, an optimal range for children his age to achieve. And his brain is achieving that range now, which is where we hear the feedback of the sounds. And also the picture will move. And we have different channels here for the different kinds of biofeedback. Can you make the picture change and keep the sounds on? Okay, and see how that picture changes? Good. So for a minute, let's hear him. Keep his sounds on. And what the sounds are doing as he achieves those thresholds is he's increasing the blood supply to his brain. The sensor is just listening to the sounds of his brainwave pattern, and he's keeping them on. And it can happen very, very quickly.
I had a happy son, and it was all kind of taken away, and it happened very fast. Because besides him not being able to speak anymore, he just wasn't happy. He was extremely frustrated. I couldn't console him when he would cry. He would, try to communicate something to me, or something was wrong, or even if it was him not feeling good, he can't, at that age, he can't say anything. So he would throw himself down, he would hit his head on the floor. It was scary. He could have done more damage, and here I am, not knowing what to do, not only as a nurse, as a mother. I can't help my son.
So instead of having an irregular EEG pattern, he keeps the sounds on and he makes it more regular. And little things like head injuries or infections or neurotoxicity can affect the flow of the blood supply through those vessels, and it can get erratic and traumatized. So just like a chiropractor, we pop that flow back in, and then he develops normally. He gets put on a normal developmental track, and his function returns. And it's very important to start very young with these children. We started with Artie when he was about 2.5, when he started to lose some of his speech and was going through a rough time, tantruming, throwing things. He really wasn't feeling well, even head banging a little bit. And we brain mapped him, and we saw that there was a bit of a lag. So we assessed with blood work and further testing what the source of his traumas, his mini traumas to the brain were, and we made the proper referrals and recommendations nutritionally, and we put him on a natural track. But it's all customized to his pattern. Everybody's pattern is different. Some people have different life experiences than others, of course, and so you want to tailor the treatment to whatever is presenting in front of you, and that takes years of experience, of course, and training to recognize the subtle symptoms.
I remember when we came in some of our first visits, I remember, I knew I was in the right place, but I saw your equipment, how you did things, and you explained it very well to me, and it was impressive. Definitely impressive, and I felt I was in the right place. And even from the first visit, I was getting answers, and I was getting the help I needed.